Hello, my name is Ivy. I'm a fourth year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about delusional disorder. We'll first look at what delusional disorder is. We'll then look at the risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Delusional disorder is a psychotic disorder in which a person has difficulty recognizing reality and has at least one non-bizarre delusion for at least 1 month. A delusion is a false belief based on an inaccurate interpretation of reality, despite contrary evidence. Non-bizarre delusions are situations that could occur and are possible, but not real, such as being followed by another person. It is estimated that 0.05% to 0.1% of people will develop delusional disorder in their lifetime. The average age of onset for delusional disorder is 40 years. However, people from 18 to 90 years old can develop this disorder. There are several types of delusions. The most frequent types of delusions include bizarre delusions, which involves a phenomenon that is impossible and not related to normal life. Erotomanic delusions include beliefs that a person, usually of a higher status, is in love with oneself. Grandiose delusions involves excessive self-worth and excessive belief in one's power, knowledge, and talent. Delusional jealousy involves a belief that one's partner is unfaithful. Persecutory delusions involves a belief that people are attacking, harassing, or conspiring against them and impeding their long-term goals. Somatic delusions involves beliefs that one's appearance or bodily functions are abnormal. Risk factors and causes. Researchers believe that the following factors aid in the development of delusional disorder. Genetics. People with a family history of delusional disorder or schizophrenia can increase the chance of developing delusional disorder. An imbalance of neurotransmitters in the brain has been associated with delusional symptoms. Studies demonstrate that delusional disorder can be triggered by stress. Other factors can include alcohol use disorder, substance use disorder, hypersensitivity, and ego defense mechanisms, including projection and denial, are believed to be linked with delusional disorder. Symptoms. The most common symptom of delusional disorder is delusions. Symptoms for jealous, persecutory, or erotomanic delusions include anger and violent behavior. People with this disorder can also have anxiety, depression, belief that they are being exploited, have concerns about whether their friends are loyal and trustworthy, perceive normal comments or events as threatening, hold grudges, and being prepared to react to perceived insults. Effects. If left untreated, delusional disorder can result in social isolation, depression, self-harm or harm to other people for those with jealous or persecutory delusions, violence or legal issues, such as harassing a person involved in their delusions, which can lead to one's arrest. Treatment. Many people with delusional disorder often do not realize their need for treatment, as they do not regard their thoughts as problematic. Thus, they do not recognize a need for help. Treatment for delusional disorder usually involves a combination of psychotherapy and medication. A common type of treatment is cognitive behavioral therapy, which helps people recognize and change their unhelpful thoughts, behaviors, and ultimately their consequences. Cognitive behavioral therapy can help people develop better coping strategies, as well as problem-solving skills. Another type of psychotherapy includes family therapy, which involves psychoeducation for family members to better understand delusional disorder. Family therapy can also improve communication and problem solving as well. Medication that a doctor may prescribe include antipsychotic medications that can block brain chemicals involved in the creation of delusions, anxiolytics to help treat anxiety or sleeping issues, and antidepressants to help treat depression symptoms that can co-occur with delusional disorder. Coping strategies. To help cope with the symptoms of delusional disorder, it is important for people to ensure that they have a good support system to help in times of need, to receive encouragement, and to prevent social isolation. Practice mindfulness, such as deep breathing, to decrease stress. Eat healthy. Exercise regularly. This can include taking regular walks and getting adequate sleep. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.